The CIMT, or Carotid Intima Media Thickness, shows you the thickness and type of plaque in the left and right carotid artery walls. Those are the arteries that provide blood to the brain, so they're kind of important. The CAC, or Coronary Artery Calcium Score, shows you how much hard or calcified plaque you have in the arteries that feed your heart. And while that's great, I think we're missing the point. This isn't an issue with plaque blocking blood flow to the brain. And this isn't an issue with plaque blocking blood flow to the heart. If you find plaque in the neck or the heart, then you're going to have plaque everywhere. It's a systemic metabolic issue that affects every artery in your body. These tests just give us one small piece of a much larger picture. So which test is better? Neither. There are two different tests that give you two different ways of looking at arterial health from two different vantage points. And since they're both in the $100 to $200 range, my preference would be to get both. The more different kinds of views I can get of my metabolic health in general and my arterial health in particular, the better. But that isn't always possible, so let's break down the differences between the two. The CIMT looks for plaque in the left and right carotid arteries, the arteries that feed blood to the brain. The calcium score looks at plaque in the arteries that feed the heart. Again, two ways of looking at a much larger picture, atherosclerosis, or artery disease. Both will show you how much hard plaque you have, but only the CIMT will tell you how much soft plaque you have, which is important because it's the soft plaque that can rupture out into the bloodstream, coagulate, and cause a clot. So that's a big plus for the CIMT. CIMTs don't require a doctor's prescription or a doctor's office visit to get that prescription, which saves you time and money. Calcium scores typically do require a prescription and an office visit. CIMTs are not typically covered by insurance. Calcium scores usually aren't covered either if you just want to do a random update. But it can be covered if your provider can prove it's medically necessary and it isn't classified as a screening exam. This means you must be showing symptoms of a heart issue, be it increased risk, or your doctor must have a good reason for ordering the test. Most doctors will hesitate at this, so you may have to strongly encourage them to help you. You might also need a referral for a calcium score. So check with your doctor and insurance company, but don't be surprised if it isn't covered, because most insurance companies won't. CIMTs typically cost anywhere from $150 to $300. Calcium scores typically cost around $100 to $400. Prices on these vary widely, and it's heavily dependent on where you live, so be sure to shop around. Neither of these requires opening you up. If you watched one of the CMT Live demo videos, you saw how just moving the ultrasonic probe around can change the results. So it's really important that you get your CIMT done from a reputable company that has a well-defined protocol and certification program for the sonographers to ensure reproducibility. And if possible, try to get the same sonographer each time. So we'll say yes, but with an asterisk. Calcium scores are done by a CT machine that does the exact same thing every time, so they're very reproducible. CIMTs look for plaque in the neck, so stents in the heart have no impact. Calcium scores look for hard stuff in the arteries that feed the heart. So if you have a metal stent, or 6 like me, it really messes up the calcium score test. I do see where they have versions of the calcium score test that can subtract out the stent artifacts, but I haven't been able to find one in my area that can do that. So for folks like me, stents are a complete showstopper and completely eliminate the possibility of getting a calcium score. So be sure to ask if your calcium score provider can handle stents if you have any. Most will say no. CIMTs use harmless ultrasound. Calcium scores use X-ray radiation. They've gotten the radiation levels very low these days, but they're still zapping your body with radiation. Which means, since CIMTs use harmless ultrasound, you can get a CIMT as often as you want. Some of the CIMT videos on this channel show you results of CIMTs done only days apart with no concern at all. Since calcium scores do expose you to radiation, you'll want to limit those to as few as possible. And since the same ultrasound technology is used on fetuses in a mother's belly, you can literally get a CIMT at any age, which is especially important now that we're seeing diabetes become more and more prevalent in our youth. And we're now even seeing evidence of atherosclerosis in newborn babies. so I don't think you can start screening soon enough. Calcium scores aren't recommended until you're 30 or even 40 years old, in part due to the radiation exposure. CIMTs typically take 10 to 15 minutes. You're in and out really quick. The actual calcium score test itself is also only about 10 to 15 minutes in the machine, but you usually have to get a doctor's prescription, which requires a doctor's office visit, which takes more of your time. CIMTs never require you to get undressed. Calcium scores usually don't either, but sometimes you get in a clinic or a hospital where they require getting undressed for everything, so be sure to ask if that concerns you. Well, there you go. That's my list of things to think about. For me, calcium score simply isn't an option because of the stents. So it's a good thing I have the CIMT available, especially since it's so quick, inexpensive, shows me both kinds of plaque, and it's safe so I can get one anytime I want, which is really handy for high-risk folks like me. Remember, I'm not a doctor and not medically trained, so please don't take any of this as medical advice. I'm just using this YouTube platform as a way for me to learn about this stuff because there's no better way to learn something than to try and explain it to someone else. So please, leave a comment below. What do you think? Did I miss anything? Misrepresent anything? Your comments will help everybody learn. And if you want to see more, check out the CIMT playlist where we have tons of videos covering all aspects of CIMTs. There's even live demos so you can see exactly how a CIMT is done.